everyone. Very pleased now to be bringing you this track on data-driven business. So APIs are all about moving data around, passing messages and initiating actions, and they can do more than just pass information. You can actually share artificial intelligence models with this. So we have a number of sessions in this track to help you understand how to apply analytics and to make better decisions. And to start with, we're going to have Dr. Nashya Haider to talk to us about analytics in healthcare. And I think you've got some great examples of how AI can be applied, but also some warnings about the best use of this. So welcome, Nashya.
Thank you, John. Thank you, Apidays, for having me today at this wonderful conference. And thanks for participating to the audience here, the API audience.
Okay, so you're going to talk specifically about how data can help us fight diabetes. Over to you.
Thank you very much, John. Good morning, everyone. Thank you to the organizers, such as John Sheila and others, for inviting me to this fabulous conference. My name is Nashya Haider, and I represent Innotech Consultants. Today, I shall talk about analytics in healthcare, combating diabetes with data. So as you can see from this map, diabetes is a global pandemic. An estimated 537 million people worldwide have diabetes, accounting for 12% of the world's health expenditures. And yet, 1 in 2 persons remain undiagnosed and untreated. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past few decades and is one of the leading causes of death in the globe. 1 in 10 adults around the world are currently living with diabetes, and the total number is predicted to rise to 643 million by 2030 and to 783 million by 2045. An estimated 45% of adults living with diabetes are undiagnosed. And over 4 in 5 of these people live in low and middle income countries. Diabetes was responsible for an estimated $966 billion health expenditure in 2021 alone. This represents a 316% increase over the last 15 years. So it's a major, huge problem worldwide. And I feel that that's a cause of concern also in Singapore, and therefore I've focused on this topic for my discussion. Now, what happens in diabetes mellitus? There are 2 main types of diabetes. There's type 1 diabetes and there's type 2 diabetes. So in people with type 1 diabetes, the body does not make insulin. The immune system attacks and destroys the cells in the pancreas. And people with type 1 diabetes need to take insulin every day to stay alive. In type 2 diabetes, people are unable to use their insulin effectively. And this type of diabetes is most prevalent all over the world, and it affects middle-aged and older people mainly. Now, diabetes cannot be completely cured, but its severity and symptoms can be managed by the use of diabetic medication, insulin therapy, and by monitoring devices such as glucose meters, and by lifestyle modifications such as through eating healthy diets and doing regular exercise. Now, moving on, I'd like to talk about the current situation of diabetes care and the current situation during the COVID-19 pandemic in developed countries. As you can see from this slide, real-time continuous glucose monitoring devices are available, or flash glucose monitoring devices are available that transmit data from the Bluetooth sensor on your arm to your smartphone. From the smartphone, the sensor glucose data can be transferred to the cloud, and from there to real-time followers who are your healthcare providers in an endocrine team in a hospital, as well as to a dashboard software such as LibraView from Abbott or Dexcom Clarity for comprehensive assessment of multiple patients. The comprehensive glucose reports are then uploaded to a chart so that the medical practitioner or yourself, you're able to see whether you're within a target range between high and low. So you're able to monitor this on a continuous basis. So in the marketplace now, there are many, many devices already available for continuous glucose monitoring, which have been FDA certified. And so what's interesting is the next generation of smartwatches, for example, Apple Watch, will also be able to monitor your glucose levels in the near future via the skin. This is a product in development, and sometimes I feel that this gives more empowerment to the patient, empowerment to the people using the consumer wearables, and it's an exciting new avenue to get into because more and more consumer companies are getting onto this bandwagon. Now, what are the healthcare trends that are driving the change, creating new processes? So the healthcare system, as we all know, is already overburdened and overloaded with the growth of diabetes and associated heart and kidney diseases in developed countries. And it will become more and more overloaded year by year. Hence, developed countries are by necessity moving to preventative medicine rather than curing a disease. And healthcare is moving from hospital care to home care. And we're moving to a behavioral change where the mindset of patients is to empower them to look after their own wellness and their own well-being and their health. And the purpose of artificial intelligence is that it offers promise in diabetes care. So the purpose is to better understand what AI advances may be relevant today to persons with diabetes, their clinicians, their family, and their caregivers, and a diverse complex set of innovative approaches that aim to transform diabetes care are getting into the marketplace. Now, let me now drill down and look at the promises of AI in diabetes management and care. The data collected from all these sensor devices means there's a massive data set to enable AI predictive solutions. For example, if I, as an individual, want to predict the risk of whether I will develop diabetes, these sensor devices or AI assisted predictive algorithms will be able to track social health determinants via biometric data in order to tell me whether I am pre-diabetic or not. And thereby, I'd be able to take preventative measures and empower myself for my own well-being. This would then be linked via APIs to a single digital infrastructure, which would be linked to specialized treatment clinics for real-time monitoring of a person who's wearing these wearables. And thereby you'd enhance the medical practitioner's interaction with the patient. And thereby we'd also be able to automate reporting. So perhaps I could gauge what my blood sugar levels are over a period of a week, because the analytical staff will be able to produce weekly reports to gauge what my glucose levels are. And thereby I'd be able to monitor my health in a more reasonable fashion rather than just going to a GP and getting blood tests done. So this would be continuous glucose monitoring and diabetes management. And even though you may not be diabetic, you may still wish to monitor your blood sugar levels to see whether you're within a target healthy range. Now, although there are many potentials for AI in the management of diabetes, there are also obstacles which one should also be aware of, especially in the conservative arena of healthcare. So let's look at some of the key challenges and obstacles. I'm sure you have encountered many of them already, yet let's briefly list and talk about them. So the investment and design, development, and deployment of AI platforms and software needs justification. And it's not only about a financial return on investment, it's about bringing on stakeholders such as medical practitioners, hospital finance and administration, medical insurance, medical practitioner insurance. We need to talk about the medical system and how all these stakeholders can have a buy-in into your project and into your software. And in the medical system, we're also very concerned about ethics, medical ethics. Data privacy and security is paramount, and the legal and compliance issues that may arise is very important to be aware of. And the AI data needs to flow and be exchanged, creating issues around medical data records. Then finally, any good disruptive technology that comes about in the market needs to process re-engineering and capability upgrading for the healthcare system if you're to implement this. And let's look at another aspect in the equation. So this creates an interesting dynamic between the relationship between your practitioner, your patient, and the payer. One needs to also ask, who is the payer? The health insurance company, the patient, or the government health service? So these are questions that arise in healthcare which one may not necessarily think about in other verticals. And the practitioner may favor regulated medical devices rather than consumer wearables. And the patient wants the freedom, and the patient wants to be empowered to own their own data for example, and is thrilled about new wearables coming onto the market, such as the Apple Watch, which would continuously monitor your glucose levels. And the insurance company wishes to minimize medical costs, so favors prevention rather than cure. So these are issues which need to be pondered about and definitely discussed when you strategize your business needs and your business case. And on top of that, we have the HIPAA challenges. So HIPAA requires healthcare data to be protected, to ensure confidentiality, to ensure integrity of the data, so that your health information which is created is maintained and transmitted via a very secure network, which is encrypted from A to Z. And one needs to also reasonably anticipate about threats and thereby make sure that all the privacy rules are obeyed when it comes to consumer wearables and medical devices. So now let's explore, how do we influence and propel innovation forward? Especially in disruptive technologies such as AI, the medical practitioners are generally a bit more conservative. The biggest aspect is to work on their attitudes, their beliefs, and behavior towards new disruptive technology. The changes in the standard operating procedures and their underlying fear of the unknown and of change. So what's also important is that there must be a coherent change management aspect to any innovative deployment. There must be a comprehensive investment case that covers both the hard financial savings in effectiveness and efficiency and the soft aspects of ethics, liabilities, legal, and compliance. Then there also needs to be a consensus on how do you educate and retrain and upskill all the stakeholders involved in the varying degrees for your AI software. And these are the four main areas where I feel that AI methodologies and AI technology can be applied for diabetes management and education. So the first area is diabetes prediction, lifestyle guidance, insurance injection guidance, insulin injection guidance, and blood sugar monitoring. So these are the four main verticals where one could create software to predict whether someone is pre-diabetic or not. And then once they are, the insulin injection guidance would show you how much insulin you'd be injecting per day. I'd like to just highlight this by showing a case study briefly from Spain. There's a company called Medexin in Spain who have recently developed AI software, and it's driven by predictive algorithms, and the software is based on a set of data from persons with type 1 diabetes, and it helps to predict future glucose levels amongst the patients in the next 2 hours. So the software would give you a guaranteed correct data, and it's intended to give the patient more control so that they can anticipate in advance whether their glucose levels in their blood are going to dangerous levels or whether the glucose levels are maintained in a healthy level. Now, how was the software developed? They used biometric data. So they used 3 or 4 types of biometric data. They monitored the blood glucose measurements throughout the day from patients manually. And they also measured the blood glucose level of patients by continuous glucose monitoring. Patients were then asked to manually input how much carbohydrate they were eating in each meal. And then they were also requested to input how much, what the amount of dosage of insulin they were injecting per day, either by manually or by insulin pumps. And they were also requested to give some information about how much exercise they were doing every day or weekly. As a result of this, the software was able to then automatically be programmed to give a gauge of predicting how a patient's glucose levels vary throughout the day according to what meals they were taking, or according to what drinks they were having, or according to what snacks they were having. So this is a very interesting software that's currently running pilot studies in Spain, and one can look into their website and find out more if you're interested. Products such as this should also be developed in Asia Pacific, because Asia Pacific also has a high tendency of increasing diabetes levels in our society, especially also in developed societies like Singapore. So it's quite an interesting software that's currently in product development. So in conclusion, I'd like to show a connected virtual ecosystem for diabetes care. So this is quite interesting. This is what I'm proposing for an ecosystem for diabetes care and management. This is the call to action for the API audience who are watching my presentation this morning, to join the game now to build a connected virtual ecosystem for diabetic care. Now, the success looks like this in an ideal situation. It's preventative rather than based on cure, and a higher rate of successful patient outcomes would be managed through an ecosystem which is driven by APIs, and which where developers can leverage these devices and platforms to create novel applications with continuous glucose monitoring data. And the APIs would be RESTful and utilizes OAuth 2 authentication, allowing your individuals to securely authorize the CGM data for use by third-party applications. So for example, to your practitioners, to a wellness guide, to your social group support. So I feel that this type of ecosystem needs to be developed also in Singapore, where you have one system linked with 8 or 9 verticals in order to manage diabetes care in a more profound and holistic manner.
So, Nashya,
Yes.
I'm really, I think our audience stay on this slide. So, because I think this is really, really interesting.
Yes.
aspect. Of course, all the technical professionals in the audience will recognize this and say, well, yeah, let's connect all of these. But I think the point of your talk is that it's not just digitize everything. It's understand what are the key things that are going on here medically with people, their health, and also the aspects of um, you know, people's health is a very sensitive issue. This data that is
Correct.
needed by different parts of the ecosystem is very sensitive, so it needs to be shared in order for healthcare professionals to make decisions and to recommend care, even the algorithms to recommend care. But the protection of that data is critical, and only authorized people should be able to access it. And the patient, the person that it concerns, should have the ownership of that, the right to authorize the sharing of that data with different people. The other thing I wanted to pick up on, though, was you mentioned false positives and false negatives. There's a challenge with any algorithm that you will have some false positives and false negatives. And sometimes, if you get a false positive, that's annoying because then you go for more tests, or the algorithm may recommend an action that is actually unhealthy for someone. Whereas a false negative gives you a false sense of security. Yeah, I'm safe.
Correct.
But I'm
Yes.
actually not safe, and I actually should be doing something. So, what are the sorts of things that we can consider to build in to make sure that this is not going to happen? Or, sorry, it is going to happen. It's just a choice of what is going to happen and how are you going to make sure that there are some checks and balances down the front.
Correct. The checks and balances, I think, in the healthcare setting, I think what they suggest currently, because there are a few apps such as these also being developed in Singapore market.
Mhm.
It's private and confidential information, so I don't want to divulge in that.
Mm.
I myself am taking part in a pilot study, and so I'm not a diabetic. I'm a healthy person. So I myself am taking part in a pilot study where they are continuously monitoring my glucose levels. Now, the the practitioners who are behind this project, this pilot project, they propose a hybrid mechanism. So when you say that there may be false positives due to these continuous monitoring devices, the hybrid system that they suggest is you keep a link with your GP. And supposing, don't get too comfortable because there could be a 10% false or positive on either side. So keep a good relationship, a personal relationship with your local GP, whereby you could go to the local GP, get a blood test done, where they will then monitor whether the values coming from your algorithm are correct or not. So you could then standardize using that. So I think in Singapore, they propose a hybrid mechanism at the
Mm.
moment just to be more cautious.
Mm. Okay.
It
Well,
has to be more
thanks.
cautious.
Yeah. Thanks
Yeah.
very much for
And, and
sharing that with us.
and I feel that I mean these devices are coming onto the market. But of course, there has to be stringent testing done. While they are developing the platforms, there has to be stringent testing done. And before it gets allocated into the market, I think there will be FDA approval required before
Mm.
it's placed into a marketplace such as Singapore, which is a developed country. So
Mm.
I think in terms of the data privacy, that's absolutely paramount. You cannot have any sort of leakage of this sort of personal data. And I'm an advocate for the patient having the right to hold on to their data. So perhaps there's a way, perhaps in the other meetings, in the discussions that follow in this conference, one could talk about how do you, um, you know, make it possible for the patient to own their data, the way they have digitalized medical data in Estonia, for example. So perhaps Singapore would like to follow in a similar manner, where the patient owns the data and it's not owned by the medical practitioner.
Well,
Um,
thanks very much, Nashya, for sharing all that with us.
yeah, thank you very much. And I'd like to actually just show my contact details if anyone's interested to have a more
Perhaps you
sort of
can
in
put them in the chat. Perhaps put them in the chat on
yeah, yeah, in-depth conversation about health tech innovation train, because
yeah.
this is a very, very exciting area um, that's ongoing. There's a lot of ongoing research at the moment. And thank
Okay.
you so much for the opportunity today from API Days. Thank you for that.